कोई नहीं.
Good evening, Dr. Rahul Grover. You are an
Hi, good
orthopedic
evening.
surgeon. Hello, good evening,
Yeah.
sir. It is an honor to have you.
Hi, good evening. Thank you.
You are
Thank
an
you.
yes, you are an orthopedic surgeon. You have done your
Yeah.
MBBS, MS in ortho, DNB in ortho, MNAMS, MRCS in UK, diploma in sports medicine from
Yes, yes, yes.
Switzerland. Wow.
Yeah,
Okay,
yeah, yeah.
so now you work as a consultant orthopedic surgeon at Artemis Hospital, Gurugram.
Gurugram. Yes,
Yeah.
yes, yes.
So I would like to ask you, what is orthopedics?
Mhm. Orthopedics basically is a branch of medicine. It is relatively a younger branch in medicine.
Hmm.
Where ortho is something related to the your bones, and pedics means in pedics means children. So
Hmm.
in earlier days, back in 1800s, so orthopedicians used to correct deformed children.
Hmm.
So deformities in the children. So that's how it all came up. So basically orthopedics means deformity correction, but now we have very diversified functions as a branch. We cater to everything which is related to bones, your muscles, your ligaments, anything which comes under musculoskeletal system of your body, of a human body. That
Hmm.
is all being catered under orthopedics.
Right. And you're a surgeon, so can you tell your
Yeah,
day-to-day experience as a surgeon?
yeah. I've been into orthopedics for past 7, 8 years now,
Hmm.
and yes, it's a very, very hectic branch. And my day at present, my day starts right at 5:30 a.m. When I wake up, I have to reach my hospital by 6:30, and so I get ready. I reach hospital by 6:30. We start operating upon the patients which are already listed for the day at around 7 a.m. That is very dot 7 a.m.
Hmm.
Right, and then we kept on operating till 2 to 3 p.m. Then I look after my patients in the OPD area, that is outpatients who come to see me in the OPD. And then I go meet my patients that I have operated upon in the morning during evening time. And then I leave the hospital around 6 or 6:30 p.m.
Hmm.
So that's how my day goes usually. It is quite hectic, but yeah, that's how the job is. It's all thrilled experience and very, adrenaline rush is there almost all the day.
How many years of training does it take to develop a steady hand in surgery?
Yeah, that's a very, very good question you have asked me. So first of all, in orthopedic surgery, it's a super specialized branch of
Hmm.
surgery. So usually what happens in our country is first we have to complete your MBBS from a medical college. That takes around 5.5 years, maybe
Hmm.
6 years. So uh, when you rounded it off, so it is around 6 years. And then you
Yeah.
enter into your post graduation. You have to clear up an exam, which nowadays known as NEET PG exam, which was in quite in news lately because of
Hmm.
the some verdict in Supreme Court. So after clearing that NEET PG exam, you have to take up a branch that you want to go ahead with. So I took up orthopedics, and then you have to complete 3 years of postgraduate training in orthopedics. After completing those 3 years training as a postgraduate student, then you have to do a senior residency, which is basically in postgraduate trainee, you were a junior resident, and then you have to complete 3 years of senior residency. So I did my post graduation as well as senior residency both in Safdarjung Hospital, New Delhi, which is a well renowned hospital. Everybody knows about it. I've completed my MBBS also from Safdarjung Hospital only. So
Hmm.
I've been in Safdarjung Hospital all throughout my training part. Then after doing senior residency, it depends upon you. If you think you need to develop something more, you have to learn something more. you have to go for some senior surgeon and ask them to let you observe in the operation theater. But in my case scenario, I was in the biggest orthopedic center in the country. So every surgery is being performed there in Safdarjung Hospital. So I didn't felt that requirement of going somewhere else to learn something else. So after that, meanwhile, I've completed all these diplomas and these MRCS during my senior residency period only. So after completing my senior residency, I've joined Artemis as a consultant there in Gurugram. So that's how the thing is. So usually it takes 10 to 12 years of training that you have asked me that how much years it takes to become an orthopedic surgeon. So minimum 12 years, maximum there's no limit. I'm still learning and everybody is learning. Even the senior most surgeons are learning. Yeah, because every day something new is coming up. Let me give you an example. These days, robotic surgery. Robotic surgery is very much in orthopedics these days, specifically in joint replacements like total knee replacement. So everybody is learning about it, even the senior surgeons. But it's really going to be a breakthrough in orthopedics, especially in knee replacement surgeries.
So how often do you have to catch up with the new medical sciences that are blooming?
Well, trust me, I'm lucky enough to be in Delhi and NCR all throughout my career and all throughout my life. So I've been in because as a capital of our country, I have always been up with the latest developments in my field, be it when I was in MBBS or when I was in post graduation. So every time I was being surrounded by the latest things only, and even now, this the hospital that I'm working in is JCI, that is Joint Commission International approved first hospital in India. It has maintained very good standards. They have got the latest machineries, and so I get to learn all the latest things. And I feel fortunate that I stay here in Delhi NCR because here everything comes first as compared to any other region.
So if an aspiring doctor wants to grow in his field, would you recommend them to come to Delhi?
Yes, definitely. Delhi, coming to Delhi is a dream of everybody. Trust me, Delhi or Mumbai maybe. So Delhi and Mumbai are two places where everybody wants to, learn, be it engineering, being medical. Everybody wants to be there because of the opportunities, because of the lifestyle, because of everything. So yeah, Delhi is one of the most competitive place to come and learn in not just in medical but also in engineering. We have IIT Delhi. You also know that.
Yes. Yes.
Call came in between.
No problem. No issue.
Sorry.
Yeah. So you
Hmm.
mentioned that there are various deformities that started this field. Can you like give examples of some deformities?
So the most common deformities that we do come across is the bowing of legs. You might have seen some people have bowing legs at the knee joint, that their legs are going inwards or going outwards. Some have got bowing at the level of elbow. Most of the people after having fracture in childhood, that is supracondylar fracture at elbow joint, they tend to develop this gun stock deformity in the elbow. So these are the most common deformities that we get to correct. But yes, there are some uncommon deformities of which can be congenital also. That is present right from the birth. So they can be related to the hip joints. They can be related to the knee joints. You name it and you have it. There are lots and lots of deformities in
What
children
happens in that?
that are there. So in those, if somebody comes with such a problem, okay. So first of all, we give them a plaster just to give us support so that the body grows in the right direction. Okay, and the deformity corrects on its own. But in some cases, if they come after very long time to us, if they neglect that deformity during childhood and they come after few years, which is quite common in a country like ours, that the people tend to ignore things at first go.
Even if they feel
Then
pain.
sorry.
Even if they feel pain.
Yeah. That's what this is the surprise that we tend to see in our setups. So what we get to do in that cases is
Hmm.
we have to perform some surgery. So it can be muscular surgery or it can be bony surgery. So that depends case to case basis. But in almost all hip deformity cases, surgery um, is the second line of treatment. First being the
Hmm.
bracing, and then surgery is the treatment of choice.
Speaking in terms of demography, what is the
Mhm.
most common age of your patients who require surgery?
The field that I am practicing in, that is orthopedics, so that deals basically a very diverse group of patients that
Hmm.
we have. So in case of children, they have children have got those children who have got deformities who come to us. Some children who come with the fractures. Most
Hmm.
of the children who play during the evening time, so they come out with the fractures around 8 or 9 p.m. at night. So that is one group of people that we cater to. Then comes the young age group, sports person who have got knee
Hmm.
injuries like ACL, PCL, meniscus injuries, or any road traffic accidents. So then we have middle-aged patients who also come with the trauma. And then in
Hmm.
older patients who have got knee problems, who have got hip problems, osteoarthritis, who have got osteoporosis. So we cater to every age because all these problems are related to specific ages, and hence we have to cater to almost all the ages. So it is not like that as an orthopedician you have to cater to only one particular age, but we have diverse groups of patients. Yeah.
If a child or anyone suffers
Mhm,
from a fracture,
mhm,
so what is
mhm.
the immediate thing you would recommend them to do?
Yeah, this is a very, very good question. And in most of the cases, parents get confused when the child got injury. They get very panicky. They rush
Hmm.
to the hospital. Okay, that is fine. You have to rush to a hospital. But yes, the first thing that you should do in case a child develops, because at that time you don't know whether there is fracture or
Yes.
not. So what you come up with is that there is some swelling, there is pain, child is crying
Hmm.
immensely. So in that case, first of all, you have to give your child some painkiller, maybe half tablet of usual that you get Dolo
Hmm.
500. Just give him
Hmm.
half tablet of Dolo 500. Apply some local analgesic like Volini gel or Iodex gel that commonly is present in almost every household in our country.
Hmm.
So then you give some ice pack, give them some ice pack that helps in relieving those swellings. So that is always good first line management in any injury, be
Hmm.
it child, be it adult. So these are some first line treatments because this will give you some pain relief, and try
Right.
to immobilize that limb.
Hmm.
If you have injured your upper limb or lower limb, try to immobilize, because the more you move it, the more pain you have it. Okay. So then you land up in the hospital, you will be in a much better position and you will be less panicky. So I think this is one thing that everybody should take care when once they get any injury of orthopedic
Hmm.
in nature, be it bony injury or muscular injury. Ice packing and analgesic is the first line of treatment that you can get. Then after you can go ahead with the X-rays after reaching out to the hospital and look at
Yeah.
what injury that you have got. Yes, so that's how it should be.
Okay. So, sir, if we focus on the development of children, we can see that their posture is imbalanced right from the
Mhm,
childhood, and that can
mhm,
lead to various deformities. So,
mhm,
what
mhm.
advice can you give?
Yeah, it is seen in the school children, and I'm very glad that even governments are coming up with such policies
Hmm.
that school bags should not be heavier, because when back in early 2000s and late 90s when I used to
Hmm.
go to school, our bags used to be very heavy, very heavy. We used to carry a lot of baggage. It would, I think, it used to be around 10 to 20 kgs when I was in class 12. But I'm glad that these days schools are uh, very aware about it, that heavy bags can lead to spine deformities in children, that can cause scoliosis, that can cause disc problems. So uh, having a heavy bag is one thing, and second, the most important thing these days is the posture and usage of mobile phones that I'm seeing in very young school children. So these children, while gaming on mobile phones, which they use of their parents, so they tend to sit in any posture they want, and they almost forget that even they are sitting on their back instead of sitting on their hips. So this is quite common in these age groups, and these children come up with the problems of backache, and even some people, some children are coming up with with the pain in the base of the thumb also. So because they all daily, they're constantly playing games on the mobile phone. So having good posture is one thing that uh, yeah, having good posture is one thing that parents should be very uh, aware of, and they must be telling their children that sit properly, sit with the back straight, and they should be able to provide their children with a good ergonomic chair while they are studying. Okay, so ergonomic chair, by ergonomic chair, I want to tell you that it is something that supports your back instead of giving stress to your back. It is more biomechanically suited to your body needs as compared to a usual chair.
So, sir, there has been a growing trend among youngsters to lift heavy weights, going to the gym, lift heavy weights.
Yeah.
So, can it? Yes.
And I'm not saying that's a bad thing to do. But the problem lies where when they do it, when they want to achieve it, their body standards so quickly by lifting heavier weights at the start, and not listening to the trainers. And specifically what happens is when they want to show it off to somebody else, okay, maybe their female colleague or male colleague, depending upon who is doing the workout. So this is quite commonly seen in specifically in young adults who are coming up with disc problems these days. That is 21, 22-year old young adults. So what they are doing is that they are lifting much heavier weight. They are doing their leg exercises with much heavier weight than what is suitable to them. So I think that you should always take expert opinion, have a good trainer, or even if you do not have a good trainer, there are lots and lots of online resources present. Always first of all, always do a basic warm up before starting any exercise during gym, or be in park, or be it anywhere. Always your exercise should always be preceded with the good warm up. Then only you go ahead with your exercises, because a warm up readies your body for the exercise. If you don't warm up, then that can lead to a lot of muscular injuries, even in your shoulders, in your knees, and obviously in your back. So, and do all these weight trainings in a graded manner. Start with the basic, then train yourself to go up the ladder. Not directly, you don't want to go directly to the top floor. So always go in a graded manner, and that's what helps in most of the cases. But if you want to straight away go to the topmost level, then you will have it for sure.
I think it is also important to listen to your body. Most people wear it as a badge of honor that I am suffering through pain, yet still I am lifting this much. But they don't realize that it is.
So that basically comes under the label of showing off.
Yeah.
Yeah.
Okay. So, with the growing rise of addiction in medicines like painkillers, so how much precaution does a doctor has to take before prescribing one to the patient?
See, in a country like India, it is the onus is not on the doctor anymore,
Hmm.
uh, because pharmacies are available almost every street in our country,
Yes.
and they don't even see the prescription. You just go and ask any medicine, they will give you.
Hmm.
So regulations are not such in our country. When you compare it to the Western world, where everything is being given on prescription only, you can't
Hmm.
get any medicine without prescription. So this is a problem which lies in our country. But as a doctor, what what we do is we just can educate the patient. So there are
Hmm.
some painkillers or some pain medicines which have got addiction potential, such as those medicine who have got tramadol in it. So they are
Hmm.
very good painkillers, but they have got addiction potential. But they are also available over the counter, unfortunately, in our country. So through your medium, I would like to, tell my to all the patients or all the people listening to this, is that always check the label whenever you are eating something, whenever you are taking any pill inside your body. You should always go online and check, because lots and lots of online resources are available these days who are giving education about the drugs. So it's always better to, read about it before taking it, whether it has
Hmm.
any addiction potential or not. And this is one thing about your pain medicines. But the more serious concern these days is about the antibiotics in our country. Uh, I think you might have heard about antibiotic resistance. This
Yes.
is the next epidemic or pandemic we are heading forward to. In our practice, almost these days, almost all antibiotics are being exhausted. They are ineffective in most of the
Hmm.
infections, because everybody is taking antibiotics at their will, and they are not completing the course. So they are getting resistant to the bacteria that is present uh, inside their bodies and causing any infection, any XYZ
Hmm.
infection. So in that case scenario, your body gets resisted or resistant to the particular antibiotics. So
Hmm.
this is like in almost every cases. What I am seeing these days is that every infection is being treated with the higher class of antibiotics, which earlier on used to be treated with the lower class of antibiotics. So the problem lies here that uh, these antibiotics are also available over the counter in our
Okay.
country. So although these online pharmacies are doing a good job, they are not giving these medicines uh, without prescription. They have to follow
Hmm.
the norms, but all the local uh, street pharmacies, they are not following any norms as such, what I think.
Nobody can keep a check on them.
Yes, that's the problem.
Hmm. People should what balance do you think people should maintain on self medication? Like, is the
Mhm.
limit till crossing?
Yeah, self medication up to certain extent it is okay. If, I mean, if you have just cough and cold, simple cough
Hmm.
and cold, you can self medicate, and if you get treated within 2 3 days, that's okay. And
Hmm.
these days, one good thing that our government of India has done is they have allowed teleconsultation, so you can also consult your doctor over video consultations. So this is one good thing, that without wasting any time, you can consult and get your medicines. But even
Hmm.
if you're not consulting, then self medication, it's okay if it is for any cough, cold, small ailments. But if that cough, cold, or any other small ailments are not getting treated within 3 4 days of the medicine, then it is better to always have an expert opinion. Go consult your physician or consult any nearest doctor. This is how it should be.
Hmm.
But do not self medicate to, uh, to a different level, that okay, I'm okay with it, I'm taking medicine and I'm suffering as well.
Hmm.
Not like that.
A growing concern is also the deficiency of vitamin D that is lacking
Mhm.
amongst a lot of
Mhm.
people in the population. So,
Yes, that's
how
correct.
much sunlight do you recommend? Or otherwise, if sunlight cannot be accessed to, what is the next
Mhm.
best thing?
You have asked a very relevant question. Last month, I went for a corporate medical camp
Hmm.
in Gurugram. So there, I saw almost 90% of the employees in that multinational company had osteoporosis. So
Hmm.
what osteoporosis is? Osteoporosis is weakness of your bone, which can be secondary to deficiency of calcium or deficiency of vitamin D. Okay, but our lifestyles these days are such that we don't have access to the right amount of the right sunlight in a day, because
Hmm.
the sunlight that we usually get access to is not helping us to make vitamin D inside our body. The right time to get that sunlight is somewhere around 10 a.m. to around 11 or 12 noon, 11 a.m. or 12 noon. After that, it is useless, and before that, it is useless. Okay. So during this time, we all are in our offices or our hospitals or wherever we are working, or maybe
Hmm.
inside our homes.
Hmm.
So the relevant part of the sunlight is definitely we all are missing out on because of our jobs and our commitments. So the best way to deal with this vitamin D deficiency is to just have vitamin D supplements, which are easily available over the counter as vitamin D capsules, which are 60,000
Hmm.
international units. You have to take just one capsule in 1 week.
Hmm.
Okay, so that is more than sufficient. So what I
Hmm.
do is I take it every Sunday, one pill. That's enough. And I
Hmm.
recommend to all my patients also that every Sunday you just have to take one pill. That's it.
Hmm. Right.
So that
So,
can help you
yeah.
fight with the vitamin D deficiency and osteoporosis.
So, sir,
Yes.
how can the problem of osteoporosis be prevented besides sunlight?
Yeah, so osteoporosis, it can be prevented, not just by taking vitamin D supplements, but also you have to exercise, you have to keep moving. If you make use of something, it will stay healthy. If you do not use something in your body, it will go on aging. So if you exercise, if you move about, if you take proper vitamins like vitamin D, calcium, etc.,
Hmm.
so that can help maintain your bone health uh, as relevant and as healthy as possible. And you can prevent osteoporosis, that is weakness of bone that happens with the age, that starts
Hmm.
after 30 years of age. So you can prevent that,
Hmm.
specifically in ladies after menopause. They have
Yes.
to take these vitamin D
Hmm.
supplements and calcium supplements. They have to take.
What I have seen with the older women also is arthritis,
Mhm.
problem of arthritis. Can you
Yeah.
elaborate on that? Yeah.
Arthritis, most of the times it is, as you have correctly said, that it is seen in older population, be it men and women, more common in
Hmm.
women. And there are some form of arthritis which are present right from the younger generation also, but they are rare. Okay, so we will talk about the common form, that is osteoarthritis. So it
Hmm.
is the degeneration of joints, most commonly being knee joint, hip joint, elbow joint, and shoulder joint. So they get degenerated. That is, they get aged as
Hmm.
you age with the numbers. Okay, so when a joint is like a well-oiled machine. Okay, if anything goes wrong with the joint, so the machine becomes very painful, or
Hmm.
machine stops working. So joint is like a machine. So this is what happens in osteoarthritis. Your joint surface, it becomes rough, and when two rough surfaces move against each other, they cause friction, and this friction will cause pain in your body.
Hmm.
So in those patients, when they move about, even at their home, even while going to washroom, while going to kitchen, they start having pains. So once a stage comes when you are not able to do your activities of daily living, like going to washroom, going to kitchen, do self-care. So that is the age that is the time when you want surgery to be done. But before that, we always tend to give them medicines. We treat them with the medicines. We give them painkillers. We give them supplements to increase joint fluid. Okay, we give them some exercises. We tell them to do at least twice a day so that the joint health can be maintained. But once it reaches that point that you are not able to do those activities of daily living, then you have to go ahead for the surgery, like total knee replacement, total hip replacement, total shoulder replacement, total elbow replacement. There are lots and lots of joint replacement surgeries are there, and we do all such kind of surgeries usually.
Sir, can we talk a little about joint replacement surgery?
Yeah, so there are lots of myths about it, specifically in total knee replacement. So lots of patients, they come and tell me that they have seen their X and Y neighbor, that they are not doing well after having a knee replacement. But this is not true. Okay, having a joint replacement is from when we do a surgery. So we are doing just 50% of the job. So the rest 50% of the job is on you, that you have to perform physiotherapy after your surgery. So in most of those cases, because even if you look at online, look it up, Google or any search engine, total knee replacement is having a success rate of 99.9%. Okay. So where that 0.1% failure goes is where when you do not do exercises after your surgery. Most of the cases, those surgery fail if you do not do right physiotherapy after your joint replacement. So usually in our practice, our patients, they start walking on the next day after surgery. Okay, so we allow them after both knee replacements, they start walking next day. Okay, and with the help of a walker, and after 1 week with the help of a stick, and they move independently after 2 weeks, and they are able to do all the activities that they were earlier used to do, even in much better way after 1 month. They can even go to park, they can even go to their temples or gurudwara, etc., nearby their home independently 1 month after their total knee replacement of the both knees. So this is what our protocol is. So that's it about the knee replacement, which is the most common joint replacement being done these days.
So what precaution should be taken after the surgery, even after 1 month?
Uh, Only one activity restriction is being given, that is you do not have to sit on the floor, on the bare floor, but you can always use some 2-3 centimeter uh, height footstool, or any stool you can use to sit on the floor, but not directly on the floor. That is just one precaution that you have to take. Otherwise, there are no precautions.
Right. They can lift heavy
Even
weights.
they can do anything. Even they can play golf in 70-80 years. There's some gentlemen that we have seen as they are playing golf even after having total knee replacement. So it's definitely not a problem. There is only one precaution, that do not sit on the floor. They can even sit cross-legged on the bed, on anywhere. All other activities are allowed. There are no restrictions.
So we were talking about different surgeries.
Mm-hmm. So these are the most common things. Other are being sports injuries. So sports injuries these days are very common, because as our country is moving ahead, there's lots and lots of enthusiasm among the sports. Even after looking at amazing performance in last Olympics that we have seen, lots of people are taking up sports these days. One thing that I would like to tell is, do not if you are doing sports, you tend to have injuries. Okay,
Hmm.
so you do not have to worry about it. Even if you get injured, there is always a treatment, and you will always be able to go back to sports. You might have heard about footballers, about cricketers, about javelin throwers that they've got knee injuries, shoulder injuries, commonly ligament injuries. But everything is treated and they are able to get back to the field up, but maybe after 3 months to 6 months.
Hmm.
But yes, it takes that amount of time, but you are always be able to get back to the field.
Hmm.
So do not worry about it. Most common injury, that sports injury that we have, is the ACL injury, that is anterior cruciate ligament injury, which is there in your knee joint. Okay, and shoulder injuries are there, which are quite common in javelin throwers, which are quite common in gym goers who
Hmm.
do not warm up and they start doing weightlifting and they hurt their rotator cuffs. So all these injuries are treated arthroscopically using in just common language, I will say, with the help of laser, with the help of camera, we treat it with very small incision of 1 centimeter to 2 centimeter in your knee joint and shoulder joint. So these are the minimally invasive surgeries. They do not cause any cosmetic problems in your knee or shoulder, and you are able to get back to your sports after having such even after having such injuries. So it is definitely nothing to be worried about. Every sports person can be able to go back to
Hmm.
their sports after such injuries.
Hmm. So do you generally use general anesthesia or specific region?
So anesthesia is something, it depends upon anesthetist. First of all,
Right.
anesthesia is not being given by orthopedic surgeon, it is given by
Right.
anesthesiologist. Second is the patient preference. So sometimes
Hmm.
we as a surgeon, and we as and even the anesthetist also prefers to give regional anesthesia. If the surgery is on lower limb, they will give you spinal anesthesia, that they will anesthetize only lower part of your body.
Right.
If it is in the upper limb, they will anesthetize only upper limb of your body.
Hmm.
Okay, but some patients, they say that they want to get complete anesthesia, that they want to sleep and they don't want to have any awareness about the surgery. So it
Hmm.
is patient preference also. So if
Hmm.
patient wants a general anesthesia, they get general anesthesia. If patients are okay with regional anesthesia, that okay, the surgery is on my knee, so I just want my lower body to be anesthetized, rest everything is okay. So
Hmm.
that can be done, and this is commonly done. So it is completely patient's preference that
Hmm.
what type of anesthesia they want to go under.
Are there any risk of general anesthesia?
No, no. These days, machines are very sophisticated. Drugs are very sophisticated. So
Hmm.
there are not such. General anesthesia is the safest anesthesia, even much
Hmm.
more safer than regional anesthesia. So it is
Okay.
definitely not a concern.
If we talk about a developing child, what kind
Mm.
of nutrition and supplements would he require for his body to grow completely?
Yeah, if when we talk about developing child, so developing child has much higher needs as compared to
Right.
a young adult, or because their body is growing like a plant. So in that child, they need good amount of proteins, good amount of carbohydrates. So very balanced diet they require, and along with the vitamins and minerals.
Hmm.
So what usually we take as Indian diet, in North Indian diet, uh, our diets are very good and very rich in almost all vitamins and minerals. But still, if we think, we can always supplement it with uh, there are calcium and vitamin D supplements they can take.
Hmm.
There are some multivitamins for children are available freely in the market.
Hmm.
Power gummies are available in
Hmm.
the
Hmm.
market, so they can take that. And in spite of that, it's always recommended to provide growing children with the lots of proteins. So proteins can be, if they are accepting non-vegetarian diet, they can go ahead with having well cooked chicken, mutton, or fish. But if they are vegetarian, so they're always things like they can go for dal, soya bean, and things which are rich in high protein and high
Mm.
fiber. So all such things are good dietary things. And if we talk about supplements, they can go for any power gummies or calcium and vitamin D supplements.
Mm. So milk is advertised as a requirement to be must
Mhm,
given to the child. So is it true?
mhm. Yes, milk and milk products are good,
Mm.
good source of calcium, and they are very much needed. Okay, but what they supplement, what they advertise is that they are needed with all those growth powders. Like, I don't want to
Mm-hmm.
name the brands,
Mm.
but they when you check their labels, it is not good. They are just full of sugar.
Sugar.
So instead of going with those powders, there are some other brands, new startups coming up in the market, in Indian market.
Mm.
They are less with sugar and more with protein content and vitamin and mineral content. So it is always better to check the label that
Mm.
what is there inside.
And coming back to the topic of sunlight, this one question
Mhm,
that people have this fear of skin cancer. Okay,
mhm.
so what should be the minimum amount of time or maximum amount of time that they should be in sunlight? What should be the balanced amount?
In our country, the location is such that sunlight is not causing that amount of skin cancers in our country. We are lucky enough.
Mm.
Plus, our skin color is a bit on the
Mm.
darker side, so skin
Mm.
cancers are not that common secondary to the sunlight.
Mm.
But yes, it still happens, but not to the extent. So it happens in those people who are working in the fields like farmers, who are working under the sun almost the whole day, who are
Mm.
working without clothes, without wearing any headgear or any shirt or something. So it is seen in that population, but not that common in urban population, and also in even in rural these days as we are developing as a country whole. So people have clothes to wear now,
Mm.
and it's not that common in our country. But yes, it is common in some Western countries
Mm.
and African countries also, who are located around around equator. And in those Western countries where they have a habit of sunbathing, so they usually get such problems. But it's not there in our country. So don't.
Mm.
It is it is a myth in our country.
Right.
And you can have a couple of hours of sunlight if you want
Mm.
to. If you have such amount of time during day, you can have a couple of hours of good sunlight from maybe 10 a.m. to 12 noon or 1 p.m. That's
Mm.
good amount of sunlight you can take.
Sir, how harmful is drinking and smoking vis-a-vis the bones
Mhm.
in our body?
Drinking and smoking, let's address this separately.
Sure.
So drinking up to certain extent is safe, but
Mm.
if you are drinking it in Indian population, if you are drinking more than 60 ml per week, or then more than 90 ml of alcohol per week, then that is harmful. And smoking is definitely harmful for your
Mm.
bones, and drinking to a large extent is also harmful to your bones. So drinking in moderation is maybe I can say it's okay, but smoking is definitely not okay.
Mm. How many surgeries have you performed?
I've been in the busiest hospital in the country, that is Safdarjung Hospital,
Mm.
is the largest hospital in our country, and the orthopedic department is also the largest. And in last 7 8 years in orthopedics, I've done more than 10,000 surgeries, be it minor orthopedic procedures and major. And joint replacements, I have performed more than 1,000 during last 4 5 years.
And So how many surgeries do you think it takes to become a good surgeon, and what are the qualities that are required?
Mhm. I think the number is quite subjective because it's
Right.
not just about the number, it is about the quality also.
Hmm.
Okay. So if you're doing it right and you're doing just a limited amount in
Hmm.
number, that is also fine. But if you're doing it wrong and you're doing it and you're replicating that wrong practice, maybe in thousands
Yeah.
of them, that is also wrong.
Hmm.
So what I feel is mm, 10, not everybody counts it because now we have a trend of documenting everything. We have to maintain a logbook. A
Hmm.
logbook is something that we have to enter all details of all the patients, the date of
Hmm.
surgery, who was the primary surgeon, who was the secondary surgeon. We have to mention it in our there are softwares for that.
Hmm.
So that's why we are able to count it that we have
Hmm.
performed such number of surgeries. But I would say if you have spent 7, 8, or maybe 10 years in a particular branch, you know it quite well. You are able to do it nicely. So I don't think that's a challenge. But the most importantly that I will tell you is that it's better to always have checked the background of your doctor from where he has got trained, because that is more important. It is not just the label, but the that what the thing more important is that where he or she is trained, because if they are not trained at good places, at high volume centers, or uh, at uh, not so competitive medical schools,
Hmm.
so then the quality of your doctor or medical professional is I don't think is good, according to my experience.
Hmm.
So usually what I have seen is that the good doctors which are there in our city, Delhi and NCR, they usually belong to the places like central institutes like AIMS,
Hmm.
Safdarjung Hospital, Maulana Azad Medical College. So
Hmm.
all these people, good doctors, so they come under categories of such that they have got their training, their basic training, MBBS, MS, or MD, or the super specialization from such institute. So it's always good to check that from where your doctor is being trained, rather than just looking at the Google reviews, because they're all fake. You all know that.
Yeah. Okay. So let's stop the recording here, sir.
Yeah, sure, sure,
Okay.
sure.
It was a pleasure speaking to you. I'll just stop the recording.
Yeah.